How did early neurotech attempt brain-computer interfaces? Imagine trying to talk to a machine just by thinking. That's what early neurotechnology aimed to do, and it all started with understanding how our brains produce electrical signals. In the year 1924, a scientist named Hansberger recorded the very first human electroencephalogram, or EEG. This was a simple way to measure brain waves by placing small electrodes on the scalp. These electrodes picked up electrical signals created by neurons firing inside the brain. This discovery opened the door to studying brain activity without surgery and sparked new ideas about communicating with machines. Soon after, researchers began experimenting with these EEG signals to control external devices. In 1965, a composer named Alvin Lucier used EEG signals to make sounds. He created a piece called Music for Solo Performer, where brain waves triggered percussion instruments. This was one of the first times brain activity was linked directly to sound, showing how brain signals could control something outside the body. In the late 1960s and early 1970s, scientists moved from humans to animals, especially monkeys. They wanted to see if they could decode brain signals related to movement or intention. These studies aimed to understand how the brain plans actions and how to translate that into controlling machines. Researchers used electrodes implanted into the brain to record neural activity directly from neurons. This was a big step because it allowed for more precise readings than EEG alone. By the 1990s, scientists developed devices that could be surgically implanted into the brain. One notable example was the neurotrophic electrode, designed by Philip Kennedy. It encouraged neurons to grow into the device, improving the quality of signals received. These implants allowed people with severe paralysis to control computer cursors or communicate by thought alone. The progress was remarkable because it moved from simple signal detection to actual control of external devices. In the early 2000s, the BrainGate clinical trial marked a major milestone. It used a small array of electrodes implanted into the brain to help a person with tetraplegia move a computer cursor and operate robotic arms. This showed that neural signals could be translated into real-world actions, opening new possibilities for restoring communication and movement for those with disabilities. All these efforts built a foundation for modern neurotechnology. They started with basic brain wave measurements, moved to interpreting signals in animals, and finally developed implants that could read and use neural activity directly. These early experiments proved that the brain's electrical signals could be harnessed to control machines, setting the stage for the advanced brain-computer interfaces we see today.